taking your calls this afternoon for Dr. Zorba Pastor.
The number 270-9933. Zorba joins us from his office in Oregon, and you were looking at that super-aging story.
Oh, yeah, very, very interesting. An article that recently came out in the journal Lancet looked at risk factors for dementia, and one of the risk factors was being hard of hearing and not getting a hearing aid. And the estimate is that somewhere between 8 and 10% of all dementia is due to a lack of hearing. And the interesting thing about it that they think is going on is that once you stop hearing other people, you stop engaging in conversations, talking with people, going out and engaging in life. And I found that very, very interesting because look at what the super-agers are doing. They're doing things together.
Absolutely.
Very, very interesting.
Social networking.
Yep.
That is very interesting.
Yes.
Okay, let's get to the calls, and we'll start with Nikki in Milton. Hi, Nikki. What's your question?
Hi, Marcus. So, and Dr. Zorba, I have a question about my eyelids. The skin on my eyelids have become flaky, and the skin is peeling off, and they've become cracked. And before I forget, I need to say a happy early birthday to Mark.
Oh, that's so sweet.
All right, so what's going on with the eyelids there, Zorba?
Well, first of all, sometimes that can be something such as eczema or another form of dermatitis. It can be due to cosmetics or the shampoos that we use or the soaps that we wash. Simple thing to do is sort of to wash the eyelids very gently with a dilute solution of Johnson's baby shampoo, a couple little drops that you can get in a trial-size bottle. Keep those eyelids nice and washed. And then I would put in initially over-the-counter hydrocortisone cream. It's 0.5%. That's all you can buy. That's the strongest you can get. Sometimes you can get 1%, but 0.5% hydrocortisone cream. Do that first. See if that works. If it doesn't work, talk to your doc. There can be something a little bit stronger. We have to be careful about the eyelids. Don't use anything stronger than 0.5% hydrocortisone cream.
Yeah, sensitive area, that's for sure. All right, let's go to Travis in Janesville. Hi, Travis.
Hello, Dr. Zorba. It's Charles.
Oh, Charles, I'm sorry.
That's okay. I have a question about the vitamin D normal range, 30 to 100. Before I started taking vitamin D, I was at 21.80, and I've been taking it for 3 months, and I'm only at 30.10 now. Should I double my pills?
How much are you taking?
I'm taking 2,000 IUs a day.
Yeah, I probably would stick to that. It takes a while, but to really build up that supply. So we often check vitamin D levels about 4 to 6 months later. So even though yours is only a little bit higher now, I'd probably just stick with that, give it some time. You can take 4,000 units if you want to, but the body might just eliminate that part that isn't going to stay in. I'd stay on 2,000 units, maybe at about 6 months, recheck it, and then if it's not high enough, then your doctor would consider upping you to 4,000 to 5,000 units.
Okay, let's go to Michael in Fitchburg. Hi, Michael. What's your question?
Hi, Dr. Pastor. Thank you. I am insulin dependent, have been for about 4 years, 2 types of insulin. I'm wondering, no one can answer the question, why my stomach has gotten bigger since I've been on insulin.
Oh, sure. Well, first of all, your stomach may have gotten bigger. We don't know for sure, but quite often it's due to calories. Gas might be an issue. But there's something called diabetic gastroparesis, and it means a slow stomach. It basically means our gut doesn't empty out nearly as quickly. Common in diabetics, there's some drugs that we use on a temporary basis. A drug called metoclopramide can be useful for that temporarily. But sometimes that diabetic gastroparesis, great big word, is the result. The result can be that your stomach is just bigger, filled with more gas, empties a little bit slower, and sometimes it needs a treatment.
All right. There is nobody on call on line 3, so
let me talk about the fact that there was an article that recently came out that said that only half of all gun owners in America keep their guns locked up and safe from children. And everyone in the state of Wisconsin, Illinois, Iowa, if they've got a gun in the house, look at the gun. If you've got kids anywhere around, make sure it's locked up and safe so that they don't get into danger, because it's an awful thing. It always happens in Wisconsin. Nearly every year a child takes a gun when they shouldn't and ends up injuring or killing somebody else. Now is the time to take action on that.
Yeah, you hear those stories way too often about an accidental shooting. Keep them locked up.
Keep them locked up, exactly.
All right, Zorba, we are out of time. Thanks to everyone for calling in, and thank you, Zorba. We'll see you next time.
Thanks, Zorba. Great to see you.
My pleasure. Take care.
We'll be right back with a final check of your forecast.